You ready?
Yes.
Well, good morning. Thank you all for coming today. My name is Melissa Duran. I am an EKG technician here at the hospital. I am also the chapter president of our union. We are here today because patients' care in Southwest PA is facing an uncertain future with an announcement that UPMC is taking over Washington Health System. As caregivers and union members, but also as members of this community, we have great concerns about the UPMC. Washington Hospital is a special place. It's an amazing example of what a community hospital should be. Many of us have worked here for decades. Many of us have walked to work where neighbors taking care of neighbors. Being a part of UPMC's expanding empire isn't one of our best interests. It is also not necessary. Washington Health System is healthy financially. We know smaller systems are under pressure, but WHS is not in dire straits and take the time to find the partner that will put patients before profits and include the community in the process. Over the last decade or so, UPMC has bought up hospitals and communities like ours, only to shut them down like they did in Braddock, Sunbury, and Lancaster, or cut services like they have done in McKeesport or Bedford. Our patients could quickly find that they would now have to drive to Pittsburgh to get care that we can provide them here today. We also care that in what insurance card you have. Highmark, we'll take you. UPMC, same. But anyone living in Western PA remembers that UPMC threats to stop counting patients with Highmark insurance. Our responsibilities to our patients and community does not end when our shift finishes. I feel that we have a responsibility to sound the alarm on what this takeover could mean to our patients and our community. To that end, we have a few speakers here today that we are going to share with unique concerns. Our first speaker is my coworker, Marissa Petro.
Thank you. Good morning. My name is Marissa Petro. I'm a certified central service technician here at Washington Hospital. I've worked here for 22 years. If you don't know what a central service technician is, we're the ones who clean and disinfect all of our instruments used in surgeries and procedures. It's a hugely important job, and I'm proud of the care I provide for our patients by making sure they avoid the risk of infection. As someone that's lived and worked here for more than 2 decades, it's hard to understate how important this hospital and Washington Health System is to our community. My coworkers are some of my best friends, and they're my family. My husband works here. My sister works here. So does my nephew. If UPMC takes over and cuts wages, benefits, or staffing, you can see how that won't just be a problem for me. It will upend my entire family. We've heard what it's like in Pittsburgh, where UPMC employs 3 out of 4 hospital workers. In a survey of more than 2,000 Pittsburgh hospital workers last year, 93% said they regularly think about leaving their job, and 90% said they don't have enough staff to keep up with their workloads. We also know that our union has filed a complaint with the Department of Justice over how UPMC uses its dominance in the region to push down wages and staffing. UPMC service workers earn a little over $1 less on average than non-UPMC service workers. I think that the wages and benefits we've negotiated here at Washington Health System are better than most places in the surrounding area. I also feel like an important part of the care team here. I don't want to be just another number in UPMC's HR database or a cost to be controlled by their accountants. A UPMC takeover will not be good for Washington. We can do better. We have to do better for the 2,000 employees and their families that count on WHS for their livelihoods. Thank you.
Thank you, Marissa. I've been hearing a lot of the same concerns from other coworkers, and we're working hard to make sure that the standards we've set over the years are protected in any merge. Our next speaker is Walt from the ACSHIC, ASHIC, unites school districts throughout Western PA to buy group health insurance and has thousands of individuals and families in this region with Highmark health insurance that depends on WHS doctors and facilities.
Thank you. Good morning. I'm Walt Wachowski, here wearing two hats today. One representing AFT Pennsylvania, a union of over 36,000 educational employees across our Commonwealth, and secondly, representing ACSHIC, a healthcare consortium serving over 56,000 lives in Southwest Pennsylvania. As an AFT Pennsylvania staff representative, I promise that our organization supports and stands with SEIU brothers and sisters in their struggle to maintain their workers' contracts, their contract benefits and rights to bargain, as well as in the fight for patients' rights for fair access to healthcare benefits that provide quality benefits at reasonable rates. I also stand here in a more complex role as chairman of ACSHIC, the Allegheny Schools Health Insurance Consortium. Born out of a grant in the 1990s, the consortium evolved into a true 50-50 labor management trust in 2003. Initially, it had 41 school districts, an intermediate unit, four technical schools. It has now grown to 91 educational entities, which include 3 community colleges, 2 intermediate units, and many school districts, CTCs, career and technology centers, and individual schools. We cover over 20,000 employees and over 56,000 individuals, belly buttons, in our plans. Our current membership footprint has grown from that beginning Allegheny County, has grown into Beaver, Lawrence, Westmoreland, and most recently into Washington, Fayette, and Greene counties. Our mission statement is to provide the highest quality health care at the most reasonable cost. The trustees do so by working diligently on wellness initiatives and doing everything possible to encourage our members to get in to see their primary care physicians and to get preventative care. We've been able to keep our rates well below market rates, but we're not exempt from market forces and have been lately forced into much more steeper than usual rate increases. During the UPMC Highmark rate dispute, the consortium chose to use a narrower network to keep our costs lower. In order to do so, the majority of UPMC hospitals were no longer available to our members, except for Children's Hospital and Western Psychiatric Hospital. The cost of including the UPMC facilities under the deal brokered by Attorney General at the time, Josh Shapiro, would have been too costly for us. Now we're faced with the prospect of a UPMC purchase of the Washington hospital system. Although Highmark has a contract currently in place with Washington Hospital System and the Washington Greene Hospital, and we've been assured of access for our members until then, what happens after that time? What about cost of services and the impact on our members? The decisions the consortium have made have saved the participants, the school districts, the community colleges, schools, and the employees money while providing them excellent benefits. While saving the entities money, the consortium is saving the taxpayers of each entity money as well. There are 9,255 ACSHIC members within 15 miles of Washington Hospital. In our last 2 fiscal years, ACSHIC has paid $7.4 million in claims to the hospital. Our members cannot afford to lose access to this facility. Our members, our entities, and our taxpayers cannot afford unreasonable increases to our costs. We need to maintain competition in healthcare in Western Pennsylvania. We cannot afford to lose anymore. Thank you very much.
Thanks, Walt. We're lucky today to have Erin Gabriel from the PA Health Access Network with us. Erin has been involved in disability and healthcare advocacy for 15 years and is working with FAN to make sure we have a more equitable and accessible healthcare system for all families. Erin?
Thank you. Good morning. Thank you all for being here today. My name is Erin Gabriel. I'm here representing the Pennsylvania Health Access Network, or FAN. We are Pennsylvania's only statewide consumer-driven organization working to expand and protect access to high-quality, equitable, affordable healthcare for all Pennsylvanians. We spend a lot of time listening to patients across the Commonwealth, from small rural towns to the suburbs to our urban communities, whether it's because they need health insurance or because they are having trouble with their health insurance or just getting the care that they need. We've done a lot of research on hospital consolidations and closures, and they have been on our radar for the past 10 years because when a hospital closes, people lose easy access to care and often to the doctors that they love. I can tell you, many of you who know me, I'm local. I take my children and my family to UPMC all the time. All three of my kids were born in a UPMC hospital. I take my kids to Children's. UPMC is not a bad hospital system, obviously, but we do notice that when big hospital systems start to consolidate and acquire local hospitals, there are changes that happen in these local communities, and we are encouraging community involvement, having some sort of community review of these hospital consolidations. So we started to wonder if there was a common thread amongst closures, particularly when they happen in so many different communities with different criteria. And what we found is important. A merger or acquisition and ownership is one of the best predictors that a community will experience a full or partial closure. In fact, according to our data, out of hospitals that are involved in a merger, change of ownership, or acquisition, 1 in 3 will close. I think that's important for local communities to hear. 1 in 3 will close. Many promises are made during these mergers, acquisitions, or changes in ownership, and sadly, communities often realize too late that those promises are broken as soon as the cameras are off and the attention fades. Excuse me. Our local communities and patients deserve better accountability and transparency whenever their community faces a merger, acquisition, or change in ownership. More than 90% of closures are preceded by a merger. 30 of the 33 hospital closures we looked at in the past 20 years, and 14 of the 15 closures in the past 5 years have been preceded by a merger, acquisition, or change in ownership. And the pace of hospital closures is increasing, with nearly half of the closures in the past 20 years happening in the last 5. The time between a merger, acquisition, or change in ownership and a closure has decreased by nearly half, from 7.6 years when you look at the past 2 decades to just 4.1 years over the past 5 years. So when a hospital closes, we know the loss of care and doctors ranks top on consumers' minds, but cost also becomes an issue. While solid historical cost data is not as readily available as we would like, we do have some data that presents a lot of questions. In Delaware County, where Springfield and Delaware County Memorial have closed, the remaining hospitals in the area often charge more than 3 times what those hospitals were charging for basic services. Prices are not just an issue in closures. When we compare smaller health systems or independent hospitals to the larger, more dominant players in their area, we see that prices vary starkly. Washington Hospital's prices are less than half those charged at AHN Canonsburg, which is right down the road. At St. Clair Hospital in Mount Lebanon, a CT scan there might cost you $402. But if you head through the tunnel and over the bridge to UPMC Mercy, you can pay nearly 7 times for the same test. And if you keep going to Shadyside, you can pay 9 times the price. Back east in the Lehigh Valley, an MRI at St. Luke's costs $650, whereas the LVHN network, it costs $2,010. Good data suggests this price variation and the ability to command higher and higher prices by acquiring local hospitals is one of the key drivers of consolidations. Larger hospitals want to get bigger and bigger, and that's important to note because frequently the reason that they give for consolidation is lowering our healthcare costs. What do hospital mergers, acquisitions, or changes in ownership mean for Pennsylvania? Closures are a huge part of the problem, but it goes much further than that. According to a 2023 statewide survey with a representative sample of Pennsylvania conducted by Alterum's Healthcare Value Hub, 58% of Pennsylvanians said they are worried about the impacts of hospital mergers on their communities. But more importantly, 1 in 8 Pennsylvanians reported that they or a family member were unable to access their preferred health care because of a merger. Of those, half, 52%, skipped follow-up visits, and nearly half delayed or avoided a doctor's visit. Of those who reported a merger caused some other kind of burden for themselves or their families, 1 in 3 reported added wait times or finding or getting the care, while 1 in 4 reported added financial burdens. For those of us who live in rural areas or might have very specific medical conditions, we know that time matters. Time and treatment can be life-saving, so those kinds of delays can be dangerous. Not all mergers or acquisitions or changes in ownership are bad. We've seen examples in Pennsylvania, particularly in the north central part of the state, Potter, Tioga, Lycoming counties, where access to care has actually been preserved and even enhanced. We have, though, also seen a nearby closure in Lock Haven, Clinton County. Communities deserve to know how hospital mergers, acquisitions, or changes in ownerships might affect them. So all we're asking is for a bit of transparency and a bit more community engagement and involvement on the part of these large hospital systems. Hospitals aren't meant to operate like large profit maximizing corporations. And in Pennsylvania, most of them are nonprofits, yet they're acting like businesses, trying to eliminate competition so they can raise prices. While hospital CEOs in Pennsylvania are making $4, $7, and even $10 million a year annually, they're buying up local hospitals and doctors' practices, and in some cases raising prices to be double, triple, or 5 times what they were before. So we're just asking for a little transparency. Thank you.
Thanks, Erin. Finally, we deeply appreciate the support that we've received from our fellow union members in the region that are part of Washington Greene County Central Labor Council. Jim Watt, our Labor Council President, is here today to speak on their behalf. Jim.
Thank you, sister. I also wear more than one hat. Today I'm wearing 3. Not only am I an international representative with United Steelworkers, but I'm also an emergency medical technician that cares for patients before they even reach the hospital, and also president of the Washington Central Labor Council. Steelworkers, mine workers, SEIU, AFSCME, we're the working class that helped build the Washington health system. We should have a say in its future. And today, more than 2,000 Washington Greene County residents work at Washington Health Systems. That's thousands of families that depend on the Washington Health System for their livelihood. And as we know too well, there's no guarantees when an owner comes in. We have to protect these jobs. The union members of Washington Health Hospital have spent decades bargaining for higher wages, better pay, better benefits, and good standards for their jobs. UPMC, on the other hand, uses its size, power, and money to push down wages and staffing. That's not good for workers, it's not good for patients, and it's not good for our community. We've also seen big companies come to town, extract all the money they can out of us, send their profits elsewhere, and leave us to pick up the pieces. It's happened before, and as you've just heard some of the examples, and we can't let that happen to our excellent healthcare system here in Washington and Greene County. UPMC is no friend to workers. The record proves that. In Pittsburgh, they viciously fought workers that tried to organize. In the past 10 years, UPMC has had over 130 unfair labor practices filed against them across their system. That's not how we do business in Washington and Greene County. Washington Greene County Central Labor Council stands with and supports our sisters and brothers of the SEIU. We support you today, we support you tomorrow, and we support you till hell freezes over. Thank you. All right, Jim.
Thank you, Jim. We really do appreciate that. Healthcare in our community and the future of Washington health system is not something any of us, can afford to take lightly. As you've heard today, there are any number of reasons why we should be concerned about the UPMC takeover. But there is good news. Before a merge can be finalized, the Pennsylvania Attorney General and the Federal Trade Commission have the opportunity to review the plan and its potential impact. Today, we are calling on both of these entities to protect our healthcare and jobs. You have the ability to ensure that a merge is in the best interest of patients and our communities. In the coming weeks, we will be reaching out to more members of the community to make sure they know about the potential of UPMC taking over and have the opportunity to share their concerns as well. We hope that this issue gets the public scrutiny that is deserved, and we thank the members of the media that came out here today to cover this. Thank you. Any questions for any of us, please?